Looking for Hawaii. You're watching Take Two.
Welcome back. 32,000 individuals in Hawaii live with Alzheimer's. Although we do not have a cure yet, there are several new developments like the recent approval of drugs that could slow down progression. And joining us to share more is Dr. Kai Liow, Neuroscience Chair and Principal Investigator of Hawaii Pacific Neuroscience. Thank you so much for being here today.
My pleasure.
So can you tell us what is Alzheimer's and is it similar to dementia?
Alzheimer's is a neurodegenerative brain disease. Early on, it affects my patient's memory and cognitive abilities. So my patients are actually totally independent and functional, not demented. Only over time they can decline and turn into dementia, where they're no longer functional or independent. So, but also, Alzheimer's is only one type of dementia. Dementia is a broad umbrella term where the patient is no longer functional, independent. There are other types of dementia like vascular dementia, Lewy body dementia, frontotemporal dementia. So it's really important that people need to understand that to seek care early, to see their doctors early, because there are different dementia types to sort out. And early on, we can also provide options and treatment options for them.
Definitely look out for those signs for sure. Can you tell us more about the research study that you guys have been doing?
Yes, we are really excited because over the years, many years, we don't really have much things to offer our patients, nothing to slow it down. We only have what we call symptomatic treatment, kind of like Band-Aid, giving them medications to kind of improve the memory. But only in recent years, in the last 2 to 3 years, we can actually offer our patients something that could potentially slow down the decline. We don't have a cure yet, so we do have medications like lecanemab, donanemab that was recently FDA approved. However, there are side effects like bleeding and swelling in the brain, that we always worry about when we give our patients this medication. So what's really exciting, Sarah, is that we are already have the opportunity to work on new treatments that can potentially use a technology called the Brainshuttle technology to overcome some of these challenges of bleeding and swelling in the brain.
Actually, yeah, it does sound like a ray of hope there. And there's a lot of medical advancements. So can you go a little deeper into that Brainshuttle technology? What exactly is that?
Yeah, so the Brainshuttle technology uses an engineering technology where it attaches a segment of an antibody to the medication and delivers the medication or cargo through the brain, penetrates deep into the brain through a barrier, the blood-brain barrier. Just like the space shuttle delivers the shuttle into space, so this delivers the cargo, the medication, deep into the brain. And because of the capillaries, rich capillaries around the brain, the shuttle can deliver the medicine deep inside and also distribute the medicine very evenly into the brain. Because of that, and we do not have to give our patients that much of the medicine that could potentially cause swelling and bleeding in the brain. Therefore, we're hoping that with this new technology, our patients will have less bleeding and swelling in the brain. And also, the important thing is that current medication takes a long time to work. Some studies shows that it could take even up to 18 months to improve the memory. And Sarah, you know that it's important to stop things and stop the decline early. The new medicines shows that we could decrease the amyloid level as early as 3 months. So this is really exciting for us, a good step forward for us to really improve the way that we can help our patients.
Yeah, truly incredible. Now, you mentioned it several times already about, catching the symptoms, trying to stop it as early as possible. Can you go over what are some of the symptoms that we need to look for, where we need to contact the doctor?
Absolutely. It is so important because we have so many things that we can offer them early on. It's heartbreaking when I see patients that are years into the symptoms and I may not have much to offer them. But when we are able to see them early, it's so much better because there are things that we can offer them. So I want to encourage my audience to look out for symptoms of memory loss, especially short-term memory loss, asking the same questions and again and again, or forgetting recent conversation. They would say, hey, Mom, we talked about this. Mom would say, no, we didn't talk about this. Or they're forgetting recent appointment, forgetting names. Those are early signs. I encourage them to look out for the 10 signs of early Alzheimer's, which are really important. And because we can actually help them. So I encourage them to seek help early, see their healthcare provider early, get the test done. There are other reasons besides Alzheimer's where they can have memory loss. So it's really important to seek care early.
Yeah, absolutely. And this also not only impacts the individual, but the families around them. And a lot of the families become caregivers. So can you tell us a little bit about what families and also caregivers need to know moving forward?
Absolutely. It's so important because we want our patients to know that they don't have to face this alone by themselves. Because when one person is affected, the entire ohana is affected. When our kupuna get affected, their husband, their wife, their auntie, their uncle get affected because, it's a team that we're really dealing with because they get lost, or they could have episodes, So it's also important that early on we bring a team of caregivers, including a social worker, a psychologist, a behavioral expert or professionals, surround our patients. And we want to encourage them, don't hesitate to reach out to seek help. They can reach out for a support group like the Alzheimer's Association, but the important thing is they don't have to face this alone because there are resources out there and we want to help.
I really love that. Knowing that, you're not alone is so important, very key. And before I let you go, wrapping up, I want to ask, where do you see the study and more of this advancement in medical technology? Where do you see that in the future? What are the next steps?
Well, we think that in the future, we really need to develop medication that can have less of the side effects, like current medication have swelling, bleeding in the brain, and less side effects. And also, we want to see the improvement early. We don't want to wait years to see the improvement. And we want to see better improvement. We do not yet have a cure. But we are as well at the same time, I am optimistic because we're constantly looking at research, constantly looking at what's next. We'll develop better technology, we'll develop better medications, better way to diagnose them early with blood biomarkers. So I am really optimistic that we can make a difference, but we do need our patients to understand, to get diagnosed, to seek help early, because we can help them.
Awesome. Well, we're in good hands with you, Dr. Liow. Thank you so much for joining us.
Pleasure.
Coming up, a quick